Hello, Grandma DC here. And I have a cold or COVID. I don't know which. But it ain't good. I've been going up to the hospital getting treatments, and I think everybody's kind of laxed off on wearing masks. Everywhere I go, nobody's wearing a mask. The other day I had my mask on at Orchlands, and there was like 4 little kids and their mom, none of them wearing masks, and the little 6 or 7-year-olds glaring at me. And I was like, if he asks me why I'm wearing a mask, I'm going to ask him why he isn't. You know? So someone, excuse me, someone's made me sick. And I could have picked it up at the hospital while I was getting treatments. I don't know. Anyway, it's been horrible and miserable for 2 days. So I was told by my oncologist there's not much I can take. And I'm on new heart medication now, metoprolol, and they said don't take Alka-Seltzer Plus or anything that works. So the nose spray's not working. I spray it up there, it runs right back out, and nose just stays stuffed up. I have tried everything, Vicks, hot water, steam. So anyway, I finally made about 4 or 5 phone calls to 4 or 5 different places, and I found a place in Warsaw that will come to the car to do a COVID test on me, because that's what I need, because I can't be around anybody, and I'm going to die here at the house alone because everyone's afraid I might have COVID. And then in the middle of all this, Bob the Eggman calls and says 3 of the chicks hatched. Not the long crowers, not the expensive eggs I bought. They're not hatching. The ones that were lost in the mail. It was the 3 I took from my chickens, which it was just Friendly's chick. She's an Araucana, and the little white one. I wasn't real excited about those. So the turkeys, the miniature turkeys, will be due to hatch on the 10th or 11th. So I'm going to have to contact the guy on eBay and say, look, the ones that got lost in the mail, not a one of them ever developed. I don't know if he'll do anything about that. He said he would, but, it's eBay. All right, guys, I got to run. I have to try to find this place and sit in my car, make a phone number, and get a Q-tip shoved up my nose. Wish me luck. Oh, look, the columbine is in bloom. Isn't that pretty? I just love. It grew here by itself, so it's wild. Comes back every year, and that's something. Okay, so I've arrived at the COVID testing spot, and I guess all I gotta do now is call them. It's about 10 minutes until my appointment, so I was giving it a little bit of time. And my battery is low. Or I recorded the first time I got a COVID test, but I'm almost out of battery, as usual. Nothing's going right. It's just the way it is when you get sick. Okay, I'm just lucky I made it here. I have clothes on. That was the best I could do. And I got to thinking, I was like, I need a Kleenex. Did I have Kleenex? No! And I dug and dug and dug, and I finally found some. Oh, thank heavens. Alright, guys, here I go. They said it would take 2 days to get the results back, so I just want to make sure I'm not giving COVID to anybody else, That's my worry. I'm a leper. No one wants to be near me, and I don't want to be near anyone else to keep them safe. So, just reminded that little kid glaring at me with no mask on, though. I just can't get over it. I think it was him. He gave it to me. Hello, Grandma DC here. Well, I've been on treatment for Her2 positive stage 4 breast cancer now for a year, and I wanted to give you all a medical update. It's going to be a little boring, actually, but there might be someone out here who understands what this means, because I sure don't. What my doctor oncologist said to me was, no significant change since the last PET scan. That was the official, what I was told, no significant change. And then I was given this report. And it says, talks about how I was administered a dose of F18 FDG intravenously. FDG. I think that is radiation. And then it was performed using a dedicated PET scanner. It goes on, it says findings. Focal area of increased uptake in the left breast with SUV of 3.7 versus 4.2 previously. Multiple left axillary lymph nodes with an SUV of 9.5, which is up from 8.0 previously. Essentially unchanged left level 5 cervical nodes, cervical, never knew I had anything cervical, with mild FDG activity. Now, I was told originally I only had cancer in my neck, my ribs, my hips, and on my kidney. That was my first PET scan. Now, this is talking about all this other stuff. I had no idea. And then it says physiological uptake of FDG is noted in the heart, bowel, liver, urinary bladder, bone marrow, and some other soft tissues. Intense focal and or diffuse uptake, particularly in colon and rectum, may preclude tumor detection. I know what include means. I know what exclude means. I don't know what preclude means. I tried looking it up, and basically it's they don't know. Or it was before the after or after the before. It's something weird. Anyway, incidental pertinent CT findings, small estimated thyroid nodule, not obvious on prior CT scans, probably due to difference in technique, no significant change since previous examination. Thyroid, never mentioned me having anything on my thyroid before. Impression, findings consistent with left breast cancer with metastatic disease in the left axillary and left lower posterior cervical region. Cervical might be, well, never mind. Region, lymph nodes. Now the wind's going to blow. Wind's, probably messing with my sound, isn't it? These findings are essentially unchanged, suggesting stable disease. No new FDG avid lesions noted. Blah, blah, blah. There you go, guys. That's the update after 1 year. It certainly sounds worse than the first one to me when I read it, but they didn't give me a readout on my first one. They said greatly improved to me on the first one. And now this one's like no significant change, but I read a lot of changes. So, I don't know. I have a horrible cold. I've been having flu symptoms. I have no smell, no taste. I thought I had COVID. I've been really sick the last week. Got to where I felt like I was breathing through a straw. I could hardly breathe. I ran down on Thursday and got a COVID test because I can't get in to see any doctors. On Thursday, my mom called her doctor, and of course you can't get in on base for a month or two. And I really didn't want to go anywhere and expose anyone to myself. I've been in the hospital on Monday, and I started getting sick after that, like the next day almost. And so I was having trouble breathing. My nose was so stuffed up and running, horrible. And I wasn't running a fever. According to my thermometer, I was actually low, which I don't run fevers. When I get sick, it runs a degree or two low. And I was at 96.7, which meant I was really sick in my world. And doctors don't believe that, by the way, so, why tell them? And so I went and called, my mom called her doctor. They couldn't see me. They were booked up. So I thought, well, we'll see if I get better in another day. I had the COVID test done. I begged, made about 4 or 5 phone calls, and finally got a place that would give me a COVID test. And I came back home, and I tried to tough it out, They told me I couldn't take Alka-Seltzer Plus or anything, just Benadryl, and I hate the way Benadryl makes me feel. All blargy-headed and dizzy and woozy, and it's horrible, and it doesn't do anything. So I went and waited till Friday, and on Friday, like I said again, wasn't getting any better. And I called my oncologist, my nurse liaison, and I told her I need antibiotics. My face was hurting. I had a horrible headache. This had been going on for 3 or 4 days. I couldn't breathe. I couldn't smell. It's getting worse. And here it is Friday, and no one will see me. You can't get into a doctor. I was even going to pay cash for one, and no appointments. They wouldn't see me. So they told me to go to the ER. Well, actually, my nurse liaison did not answer the phone, and she didn't. When I left a message saying I need antibiotics, I've got a sinus infection. I took a COVID test. I haven't heard back yet. And I never got a call back, no answer. This is what happens every time I call my oncologist. I have like 3 or 4 phone numbers. They don't answer. My oncologist says, well, you just got to keep calling back. People are busy. They don't want to talk to you. And I'm like, okay. So I quit calling them. But I called on this because I felt like I was dying. I was like, I can't breathe. This horrible headache. It's been going on for days. And finally, they called me back on Saturday and said I did not have COVID. Well, by then I had started taking Alka-Seltzer Plus anyway. I'll just be honest with you. I said dead would be better than this. I have got to have some relief. And that helped a little, kind of cleared, but I still had the headache and the sinus pressure. And so finally, I gave up and I had some steroids here from when I was doing chemo. And I thought, I got to do something. I started taking them. And that has helped. I can breathe again. It has cleared up my head, cleared up my headache. So you just sometimes save your meds. You got to self-medicate because the doctors around here won't take care of you. That's life in the United States. That's the way medical is. So, you know, go to the ER. Well, yeah, expose all those poor people. You know, what if somebody comes in with a broken leg and you give them this horrible flu or COVID, you know? Ridiculous. So, I'm trying to get better on my own. It's Sunday. And, you know, sitting out here getting some vitamin D a little bit. I'm sure the wind is messing with my sound. And I'm still, you know, hoarse and I'm still congested. But I know it's not COVID, which was I didn't know there was real germs left in the world. You know, I probably got it from the hospital. Because honestly, they aren't sanitizing like they used to. You're allowed to take in 1 guest, which I like. Pam went with me this time. And, you know, they're not wiping down the doors and spraying or wiping down the chairs in the waiting room anymore. I noticed that the chair wasn't wiped down before I sat down in the infusion room. And I went in with a really nice nurse. He was wonderful. He gave a great infusion shot without hurting me and took his time. It was a lot better than the last couple of times. And he, you know, was super as far as that went. But I noticed like they took me into these rooms that had obviously not been, you know, sprayed or sanitized, not to any great extent, because everyone's kind of backing off and relaxing about it. And so somewhere along the lines in the bathroom, I used the bathroom while I was there, and I tried using hand sanitizer as much as possible, but maybe I'm slacking off too. I was wearing a mask, of course, but I used to like carry hand sanitizer and just do it constantly. I need to start doing that again. I need to start, you know, spraying the inside of my car, using the hand sanitizer more often. I'm not going to be going into restaurants anymore. We went into one after the hospital and did a Mongolian, which was really good. It was the last thing I tasted before my taste and smell left me. But, yeah, that's what's going on, guys. I tried to get a picture of that bird of Mother's that's pecking on her window and talking to her. But I never could. I'm still going to try to do that. I've got some video of where we took Sadie to the veterinarian. We had to go to the bad veterinarian, who ended up giving her the same antibiotics we told her not to give the dog because she just throws them up. And she said, don't give it to her with dairy. The dog hates cheese. It didn't take her pill with dairy. But, you know, again, it's like, at least she let us do a walk-up, and she saw the dog. And Mom tried giving her the Cipro, I think it was, and she threw it back up. We did 2 days in a row. Her ear was swelled up, and it had cysts that were, the whole side of her face was swelled. Well, on the second day, even though she threw up the Cipro, the cyst burst. And I did surgery, and I got the pockets out and all that out, and she's healing up now. So that was lucky. I filmed some of that. I'll have to do another video for you. And so it'd be in a retrospect video, you know, about the dogs and stuff. And I'm feeling a lot better with the steroids. You just got to treat yourself. That's all you got to do. You just can't rely on the medical system. And man, if you go to the emergency room, it's $60 copay plus, and they start billing you, and then they send it off to collectors, and you know, you never know what the hell. it's a nightmare when you get involved with the medical system here. So I just didn't want to do that. I'm in debt far enough now, I'll never get out. So, yeah, guys, it's a beautiful day today. It rained last night. I've got my garden mostly planted. Some of it's growing. I think the chickens have gotten in there and eaten some of it. I may have to replant. I don't know. So I love you all. Thank you so much for supporting me through all this emotionally and monetarily on my homepage. You always click on my funny face and go down to my PayPal. So many of you do. And I so appreciate it. It's really helped with gas and stuff and getting back and forth to the hospital. I read a lot on metastatic breast cancer site, these women that have it much worse than me. And I really feel blessed and lucky that I have been able to survive as well as I have. Some of the pain has lessened, but that's because of the steroid I'm taking. And they're going to send me a new pain pill. I have to go pick it up today, but the copay on that's $40. Isn't that ridiculous? Pain medications, your copay is, my insurance hardly pays anything for that. And so I'm going to go pick that up today. I don't have to go in. The pharmacy will bring it out to my car, which is fantastic. And we will be using Lysol in the car, and I'll be wearing a mask, and because I don't want to make anybody else sick. So that's my main concern right now, guys. And we got 3 more months till another PET scan, and I am considering options. I feel like I wish I had a doctor that would say to me, eat 1 head of lettuce with nothing on it 3 times a day for the next 3 months, and then maybe it'll improve things. Give me something to do. But they all tell me diet doesn't matter, nothing you do matters. It's all about the medication, which I'm only taking anastrozol. I know a lot of people are talking about taking Ibrance and anastrozol or other things with anastrozol. They're only giving me just anastrozol. And of course, the Herceptin and Perjeta infusion every 3 weeks. So, I don't know. I wish there was another treatment out there, something to try to make it better than what it is. To back it up a little more, because it doesn't sound like it's backing up anymore. I don't know. Time will tell. Love you all. Thanks for watching. Bye-bye. A naked dog laying in the sun. He had a tick on him this morning. I had to take that tick off. That's right. All right, girls, I'm coming. We're going to let you out today. Yep, it's a beautiful day. Look at the mushrooms growing out of the side of my straw. Anybody know if those are edible? They got brown gills and kind of a yellowy top. Huh, should I take a chance? Let me know.